It's my utmost pleasure to talk to you, Robert, today. Could you please introduce yourself and what do you do for business?
My name is Robert Finlayson, and I'm a clinical hypnotherapist. My business's name is Finlayson Hypnosis, and I'm based in central London.
Perfect. So let's go with our first question. What is hypnotherapy and how does it work?
Well, hypnosis, the word hypnosis comes from the Greek hypnos, which means sleep, which hypnosis is not. Hypnosis is essentially talking therapy, and it's a therapy that involves many different modalities that includes hypnosis or trance as part of the therapy.
What is the difference between hypnosis and the trance?
They're the same thing, really. Hypnosis is just another way of describing trance work. As I said, hypnosis is really, to put simply, it's a deep state of relaxation in which your imagination is activated. It's also a particular state of mind that's induced by the therapist. You can experience it on different levels: light hypnosis, medium trance, or deep hypnosis. And I use the word trance and hypnosis I interchange them. They're one and the same thing. The idea is that it allows the conscious mind to be sidestepped and disengaged whilst, an accomplished therapist can install sort of new positive ideas and suggestions directly into the critical unconscious of the client.
So let me ask this question. Do you manipulate the human mind or the human brain?
No, I think there's a sense that hypnosis can be some sort of weird mind control. It can be used as part of that, but that's a far more complex and sort of dark way of looking at it. So no, in therapy, in healthy therapy, you're not manipulating people's minds. You're basically doing work. You're helping the client achieve what they wish to achieve. All hypnosis is really self-hypnosis. So whether you are practicing it by yourself at home or whether I'm guiding you in it, ultimately you are taking yourself into trance. You can't be made to do anything you don't want to do. You're not out of control. And I think some of the confusion comes with things like stage hypnosis, where people are made to do ridiculous things and act like chickens and imagine they've touched something really hot. There are all kinds of other issues, factors that need to be taken into account when you see that kind of hypnosis. And it gives therapeutic hypnosis probably a bad name.
Mm-hmm. Okay. So let me ask another question. How can you implant or how can you create these new ideas in the person's consciousness?
Well, you use imagery. So the use of words and imagery is very important. So let's say somebody has a particular issue with anxiety, a phobia. They have a phobia of birds. They're unable to actually deal with birds in real life. So in hypnosis, in the safety of a therapy room, a good therapist is able to sort of virtually, if you like, expose the client to that which they are fearful of. Mm-hmm. And so it's one of the techniques. You can do it safely. You can use the client's own powerful imagination. And so most people are hypnotizable, but some people are more hypnotizable than others. I do quite a lot of work with actors because I am also an actor and I was an actor in my life. And actors tend to have great imagination. So they're pretty good clients most of the time. Subject.
Very nice. What can hypnotherapy cure?
It doesn't cure anything. I'm wary of using the word cure in any kind of medical or ethical sense. It can significantly change and turn about an issue completely, but it's particularly good with issues sort of like anxiety. If you are in a hypnotic trance, or any kind of trance really, your stress response is turned down. So if I'm dealing with clients who come in and they have performance anxiety, for example, and it causes them a great deal of distress, they feel it and they felt it for sometimes weeks or months or even years. When you take someone into a deep trance, all their stresses responses are turned down, and it's a very good way for managing stress. And so there are practical techniques, breathing techniques, visualization techniques, all of these which are part of the process in order to manage stress. So anxiety and stress, it's particularly good for.
Mm-hmm. Okay. So what are the risks of hypnotherapy?
Well, I think you need to work with a therapist that is experienced and that is qualified. One of the problems I think with hypnotherapy is, I studied it for 3 years at postgrad level, but you could do a weekends course and call yourself a hypnotherapist. It's not regulated in the same way that medicine is regulated. So working with someone that has a history, a track record, and is experienced, I think is important. The risks are certainly probably the greatest risk, really, if you're dealing with issues like trauma or childhood or abuse and so on. You've got to be really careful. The minute you start doing regression work, there is a risk that the client might have a bad reaction, and so you've got to know what you're doing and be able to resolve those abreactions.
What are the requirements to be a hypnotherapist?
Well, the training, as I said, it can vary. It can be, so there are almost no requirements. You can train for a weekend or you can train for 3 years like I did. I think you've got to have the same sort of skills as any good therapist would have, good interpersonal skills. So there's a good set up good relationships. You've got to be inquiring. You've got to be empathetic. You've got to work from a place of positivity. That's what I would suggest. Fundamental skills. I think being an actor, having skills as well in terms of being able to pace, because you're using language, using imagery, using certain pacing of language in order to take people into hypnotic trance. If you've got those skills, that is also helpful.
Okay, may I ask you a follow-up question here? Like, mainly you are speaking about actors and you are speaking with visualization and imagination. Like, this gives me the idea it's all it's a different reality from where we are living. Do you get what I mean?
Yes. When someone is in a trance, they kind of, they've done brainwave encephalograms and so on, and we tend to enter a different brainwave state, and it's a theta brainwave state. So it is that state very often that we experience just before we fall asleep, or just before we wake up, or sometimes when we're deeply relaxed and kind of drifting off. It can happen. You can have an awakening experience of it as well, and so visualization, most people are visual. So when you ask them to imagine something or to picture something, they do that. About 60% of people work on a visual modality. But then there are also people, and this is a skilled therapist will realize, that sometimes they'll have a client that can't see things, can't work in that way, and they are more kinesthetic. So they talk about, I feel this, and it touched me in this sort of particular way. And so one would work slightly differently with them, and perhaps more on feel rather than image.
Okay, what is suggestion therapy?
Well, hypnosis is suggestion therapy. It's all based on suggestion, and so there are different ways of doing it. So kind of classically, and I think this covers one of your other questions, classical hypnosis is very direct and authoritarian. You will do this, and it's often repetitive. And there's no sort of black and white, whereas modern hypnosis, the Ericksonian kind of hypnosis, is far more permissive. And so suggestions can be couched in many different ways. They can be direct, they can appear to be one thing, they can appear to give you a choice of things, where in actual fact, the choice will inevitably lead you to the kind of suggestion that a skilled therapist would like to give. But the focus always is on what does the client want. And I think the minute you're in a situation, if there's a therapist that is trying to demand of a client that which they don't ultimately want, they've not come to you for, then there are warning signals there, I suppose.
Like, do you mean you suggest what the client wants, not what you want as a therapist?
Yes, you lead the client, and that's the key. So why has the client come to you? What do they want to achieve out of the sessions? And obviously, when you're dealing with clients, a lot of their problems are they're not necessarily resistant to hypnosis per se, but they're resistant to the change of behavior, for example. If a smoker comes to you, they can say, well, I want to stop smoking. That's my desire. But there are a whole range of underlying subconscious factors which are mitigating against stopping smoking. So you have to work with those.
So let me rephrase this, like you are exactly guiding people to something that they want.
Yes.
Okay.
I mean, if someone comes in and tells me this is what I want to achieve from therapy, I'm not going to try and achieve the opposite with them. But what clients want, and we all know this with things like behaviors, with things like addictions, we want to do something, but how do we get there? And it's about addressing through hypnosis the resistance, if you like, to making that positive change.
Yeah, another question. Like, if people want you to guide them to something they want, why can't they do it by themselves?
Well, that's a good point. Well, with behaviors, very often these patterns have become very ingrained. Where I suppose it's teaching skills. So one of the skills one does teach, apart from guiding people as a therapist, you also teach them to practice self-hypnosis. And, some basic skills, whether it be hypnosis, whether it be meditation, all of these things can be beneficial, but they need to be taught. And as I said, quite often clients will come in, they'll experience extreme anxiety, for example, if they're dealing with particular. And so not only are you practicing hypnosis, but you're also educating and you're providing them with materials so they understand their condition better. You're teaching them, whether it's simple things like breathing skills in order to vagal breathing skills in order to kind of help them regulate their stress response. It's an eclectic form of therapy, and it draws from many different areas.
Okay, let me ask you another question here. Like, can a person want something while inside or subconsciously they cannot achieve this, or they really don't want to achieve this?
Oh, I think that happens a lot of the time, particularly if you're dealing with things like addictions or behavioral issues, or whether it be things like alcohol. Very often, food is an addiction. So I will say this: when it comes to things like drugs and alcohol, hypnosis can certainly be beneficial, but it is usually used as an adjunct to other forms of therapy as well. So the person usually needs to be addressing those kinds of problems in another way, in another form of therapy, and then hypnosis can help kind of support and strengthen their desire to change that behavior.
Okay, let me ask you a difficult question here. For example, I come to you and I want something, however, subconsciously I don't want it. How can I cover these hidden reasons or hidden elements that prevent me from moving on?
Well, so I would probably, one of the things I would do is maybe use parts therapy. So parts therapy is used in many different kinds of psychotherapy modalities, but you say you want one thing consciously, and subconsciously there is a resistance to it. So so what is the part that's the problem? And you can do parts therapy in trance, in hypnosis, and the argument is that it can be infinitely more powerful because one is dipping beneath that sort of line that separates our conscious from the subconscious. The parts that are resistant or problematic are usually parts that we are not fully aware of, or sometimes not aware of at all. And hypnosis is an effective means of accessing the part that is causing the resistance.
Very nice.
What does that part want? What is it? Has it been doing for you? Because there's always been a reason it's there. And are there other parts of your personality that could help? And that sort of understanding is often I use it with Stop Smoking. I do it in 2 sessions. The first session, I'll look at the part. What has the part been doing for you? Is it willing to change? And then the second session is usually far more kind of direct and authoritarian.
Mm-hmm. Very good. Okay. What is analysis in hypnotherapy?
I suppose a lot of analysis is just one of the eclectic forms of tools that are used. Probably the most obvious form of analysis would be regression. So regression back to a particular event, or regression back to childhood, and that's the sort of more analytical side of hypnosis work. Other times, depending on what you're looking at, you might look at a sort of cognitive behavioral approach and then add that to hypnosis. But quite often there's a little bit of everything. More often than not, a bit of coaching, sometimes a bit of education, a bit of analysis, maybe a bit of regression, maybe a bit of kind of dealing with the cognitive issues, the behavioral issues, our beliefs and what the consequences of those beliefs to a particular event or situation.
Okay, very nice. What are the hypnotherapeutic approaches with the children?
That was a question I meant to sort of. I worked with children a little, but not terribly much. It's just not been a particular field of interest. The great thing about children is that they haven't sort of developed too many resistances. So if you use imagination, and you can use all sorts of skills. You can use dolls, and you can actually let the doll hypnotize the child. The child has a relationship with that toy, and if you work cleverly with it, you can use skills like that. Children are, as I said, pretty suggestible. I mean, that's the very nature of it. And in fact, just with regards to that, certainly in early childhood, most children actually spend their time in a theta brainwave state. So much like hypnosis, you are able to kind of, give these suggestions, you imprint them. And so children, kind of young children anyway, go through their days where they're simply having that information imprinted on them without too much kind of filtering. And because they don't have that filter, certainly clinicians who are, or therapists who are experienced, have all kinds of toys using imagination. It's a kind of, I think they use kind of play a lot more than perhaps one does with adults.
Mm-hmm. Okay. What is the difference between guided hypnosis, hypnotherapy, and self-hypnosis?
It's the same thing, really. I tell clients, I think a lot of people find it easier if they're in a therapy room and you are giving them suggestions and they've built up a rapport with you and it's lovely and relaxed and they've got a lovely chair that they can lie back in. But essentially, you are asking, or you're directing them to take themselves into an altered state. And so I encourage clients to learn basic self-hypnosis. It's not complicated. It doesn't have to be, you don't have to sort of drift off deeply. I will sometimes do it on a train. I'm kind of aware of what's going on. I might even open my eyes at each stop and then just close them again. It's a light trance state, and you can work on different levels. It's one and the same thing. It's just either I'm guiding you to take yourself into trance, or you are guiding yourself to take yourself into trance.
Okay. So what is the best hypnosis for weight loss?
Well, that depends. There is no one sort of size fits all, to use a term that perhaps is relevant to weight loss. It depends. I think it's important to understand what is driving the client. Weight loss is complicated. We think of it as sort of simple. You know, you can see a client for a phobia, and you can see them in 1 or 2 sessions, and you're able to significantly improve or, in fact, eradicate that phobia altogether. The problem with weight loss is that it takes time, and that, you know, in our day-to-day lives, somebody who's trying to lose weight is constantly challenged by the triggers, life changes. It takes time to burn off fat, to burn off weight, and so it's actually quite intensive. And weight loss, the clients that are successful, I will see for months on end, because that's how long it takes to lose weight, and they often need a lot of support along the way. And so the successes, and I've had some people have lost sort of 6 to 8 stone, which is times 14 pounds. I don't know what that is in kilos, but it's, you know, significant losses. But that takes a year, and so quite often I'll see them fairly regularly for the first 6 to 8 weeks, and then we'll sort of have a check-in and see how things are going as the year progresses and as they wait. And then very often with weight loss as well, is that clients will lose weight initially, and then you probably know this, they get to a point where they plateau. The body kind of, the less weight it has, the less hard it starts working. So you then have to deal with those little kind of hiccups, because quite often that can be when clients give up.
Okay, let me ask a question here. For example, if your therapy of this kind of treatment takes time, then the patient's or the customer's conviction may become weaker. So how does time and self-conviction affect this kind of therapy?
Particularly with weight loss, if you were sticking with that theme, it's important there are lots of tools that one uses. So whether it's keeping diaries, whether it's using charts, whether it's posting pictures on your food cabinet of how you want to look, so you kind of reinforce a positive image, and then one records. I either record in the session, or I may record hypnosis scripts based on those sessions and send it to clients. And so the more motivated they are to listen to that reaffirmation of reaffirmation of their goals, kind of, what do I do today? What do I do this week? What do I do in the short term, medium term, etc. There are lots of ways. So practicing your self-hypnosis, listening to my recordings, keeping records, and then if eating and weight loss is very much linked, as it sometimes is. I mean, sometimes it's just behavioral. It's a habit, a bad habit, and that's perhaps easier. It's when eating is related to other issues. Could be related to things like abuse or feelings or problems about, emotional eating. And so then you have to address the kind of underlying issues, whether it be abuse, whether it be emotional upset.
Okay. What are the benefits of hypnosis?
Benefits, well, you'd have to ask people. The benefits of hypnosis are, it's beneficial when there's a good outcome. That's the benefit. I think that quite often I will see clients rather. I work for a charity organization that deals with clients with long-term health conditions. And there's a very specific sort of a range of issues, but specific kinds of clients. The benefit is quite often when people have done a lot of other therapy, and they have a lot of talking therapy, and it's not really worked for them. And they come to hypnosis very often. It's sort of the end of the line, if you like. And a good hypnotherapist using trance work will then be able to give those clients a sense that they are actually able to do something for themselves. And that, I think, is probably one of the biggest advantages. It just allows people to very often experience their problem or issue in a way that they've not done so before.
Okay. What is traditional hypnotherapy?
Traditional hypnotherapy is sort of, it's the sort of straight with a big moustache and the beard and the hat and the fob watch kind of going like that. Going, now you're going to sleep, and it's authoritarian. It tends to be direct and authoritarian. The language is it's kind of it's kind of what's the word I'm trying to use?
Directive, imperative.
It's directive, imperative. There's no black. It's black and white, and it works particularly well with certain kinds of clients. So, strangely, if you're working with someone who's been in the police force or in the army, they're used to taking orders. It's part of their system. That kind of authoritarian approach will probably work for them. If you are dealing with someone who's extremely anxious and kind of wary, it may be that initially an authoritarian approach would actually get them to recoil and resist in getting engaged in the process. And the other sort of modern technique, the Ericksonian hypnosis, is far more subtle. It uses a wide range of techniques, imagery, suggestion, couched in all sorts of subtle sort of ways. It appears to give very often the client or the patient the choice of making one thing or another, whilst if it's done cleverly, they then make the choice that you want them to make. So yeah, and I think quite often therapy, it's very often not just one or the other. You use a combination of both of those.
Okay. What is solution-focused hypnotherapy?
That would probably be hypnotherapy that includes things like outcomes. So focusing on the future, focusing on the preferential outcome, and include less of things like regression. It's very often involves some sort of coaching techniques, and yeah, I mean, ultimately, all hypnosis, hopefully, is solution focused. Mm-hmm. But I think it would tend to focus less on techniques which are like regressive and more of a coaching approach involved in it as well.
Okay, what is cognitive behavioral hypnotherapy?
It's cognitive behavioral therapy plus hypnosis. So you would use the same, you'd use the same kind of skills. It quite often involves working with worksheets, asking clients to go home and do particular kinds of homework, which are cognitive behavioral, and then taking clients and hopefully strengthening their understanding or their solutions through hypnosis. So you might take them through a regular cognitive behavioral technique and then take them into trance and actually, let's say it's a sort of cost-benefit analysis type approach, in a state of heightened imagination, get them to really kind of visualize or picture, one side, the cost as opposed to the benefit, and then emphasize the benefit. So it's the same thing. You're working with boards, you're working with charts, you're working with worksheets, and then you're strengthening the results in trance work, reinforcing the results in trance work.
Okay, now you are talking to the people will watch you. What do you tell the people about hypnotherapy? How should people embrace or look at this kind of medicine or this kind of treatment?
I think that there is a bit of wariness in some people. Some communities are quite suspicious of it. They think it's sort of, it has negative, really kind of negative connotations, almost on a spiritual level. And really, as I said, you are asking clients to simply go into their own imagination and to use their imagination. also, I tell them that we experience trance or reverie many times a day. I'm sure we've all experienced sitting on a train and staring out the window and landscape flashes past, and we sort of suddenly go, I don't know where I've been for 5 minutes. Time seems to change, and that's one of the indicators of trance is time is stretched or shortened, or you lose a sense of trance. And even if clients are in a light trance and they think they've heard everything you said, you quite often you'll go, well, how long do you think that was? And they'll go 10, 15 minutes, and you were talking to them for half an hour, 45 minutes. So that's one of the things. You can get really engrossed in a film or a book, and that's also a form of waking trance. You can't be made to do anything you don't want to do. You will respond in an emergency. I've had a client, they were in a pretty deep trance, and the fire alarm went off. I told them that it was in trance. I said, it's, this is fine, you're perfectly safe. But then their phone went off, and I think it was childcare or something. And interestingly, they were fine about the fire alarm right above their head, but they opened their eyes and wanted to answer the phone. So you are in control at all times. It is not sleep. It is another state of mind state, if you like. I don't know if that answers the question.
Yeah. It has been more than a pleasure to talk to you, Robert, today. Thank you so much. I cannot appreciate your help enough, really.
Been lovely to talk to you. Thank you.
Thank you.